Hello, everyone. Good morning, good afternoon, and good evening. I'm Jennifer Adams, the Acting Assistant Administrator for the Bureau for Global Health at the U.S. Agency for International Development. And I'm very happy to welcome you and excited to join you all on this opening day of the Global Digital Health Forum. The theme of this year's conference, Improving Health Through Digital Transformation, aligns closely with USAID's belief that digital technologies have a critical role to play in achieving our global health and development goals. At the Global Digital Health Forum last year, USAID launched our first ever Vision for Action in Digital Health. This vision builds on USAID's inaugural digital strategy, also released last year, which articulates our view on the transformative potential of digital technologies. Then this spring, we released our Vision for Health System Strengthening 2030, which details the role health system digitalization can play in supporting greater health equity, quality, and resource optimization. Together, the strategy and these visions create a framework that describes how USAID is aligning our investments both to be responsive to country needs and capacities and to help partners achieve their health goals in a digital era. The COVID-19 pandemic has reminded us how important access to health data is for understanding and addressing global health security. And it has underscored once again the critical role of digital technologies in enabling access to time-sensitive data. At USAID, we see the potential for digitalization to increase access to health data and support targeted and adaptive decision-making at all levels of the health system. Yet we also know that significant barriers to universal digital connectivity remain. We would acknowledge that the process of health system digital transformation has been uneven and often driven by the goals and funding streams attached to specific health verticals rather than a system-level view of digital transformation needs. Today, I'd like to take stock of where we are 1 year after the launch of our first digital health vision. To do so, I will share highlights from our work that demonstrate how we are delivering against each of the vision's 4 priority areas for our external programming. And I'll also share some steps we are taking to navigate our own internal digital transformation journey. So let's start with what we're doing to align our external programming to the priorities of the digital health vision. The vision's first priority is to assess and strengthen digital enabling environments in partner countries. We recognize that the effectiveness of digital technologies is directly linked to the strength and capacity of their use environments. As donors, in order to make strategic investments, we need to understand both the digital systems in use in a country, as well as country capacity to govern and manage digital systems and data. Harmonized and regularly repeated digital use environment assessments are critical to enabling funders to align their investments to country-identified needs. An example of how USAID is contributing to this effort can be found in our recent work with partners at Digital Square, an initiative we designed to facilitate co-investment in smart and scalable digital health technologies. The Map and Match project matched over 2,900 digital tools used in 135 countries, and then matched them to specific COVID-19 response needs. The project then honed in on 22 countries to outline opportunities to adapt existing digital tools for the COVID-19 response. In doing so, it identified opportunities for COVID investments to strengthen country health systems, helping add value beyond the COVID-19 response. Through this work, we were able to record data on more than 2,500 country-specific digital system investments, which will be added to the WHO's Digital Health Atlas, making access to this information more accessible to all. The second priority of the digital health vision is to strengthen national digital health strategies. These strategies chart a course toward country health sector transformation across health focus areas at all levels of the system and in collaboration with a diverse stakeholder group. In alignment with the WHO's global strategy on digital health, USAID seeks to help build and strengthen national digital health strategies and their costed implementation roadmaps. One example can be seen in the work of the Country Health Information System and Data Use Project, known as CHISU. In Serbia, CHISU is working with the Prime Minister's Office and other stakeholders to develop the country's national e-health strategy. The strategy charts a course to develop standardized electronic health records for clients, improve interoperability, and increase the quality of health data. A national digital health strategy alone, however, is not enough to ensure technology investments work well together. That's why the third priority of our digital health vision is to strengthen national digital health architectures. These blueprints are critical to translate a national digital health strategy into action by helping to establish software and hardware requirements for digitally supported health programs and enabling planning for interoperability between standalone digital data systems. One example of supporting digital health architectures can be seen in our work on digital supply chains. Over the past year, USAID has supported the development of a standards-based national product catalog. This tool helps harmonize identifications associated with various health commodities, which in turn helps countries to effectively track and deliver these commodities. Countries including Malawi, Rwanda, Zambia, and Ethiopia are using the National Product Catalog as an enabler of interoperability between supply chain, regulatory, and health information systems. The fourth and final priority of the digital health vision focuses on leveraging global goods. Global goods are tools including knowledge products and software that are open source, adaptable, and reusable to meet different needs. Prioritizing global goods helps ensure that the digital tools we invest in are adaptable, scalable, and available to meet new needs as they emerge. To support this vital work, USAID invests in Digital Square, which has grown to encompass 18 investors, pooling funds to support 38 digital public goods. In 2021, the US government contributed more than $15 million to Digital Square, and we extended the project for another 5 years. I hope that these examples have helped to demonstrate USAID's commitment to improving health through digital transformation in collaboration with partners around the world. Telling this story would not be complete, however, without acknowledging our efforts to address our own internal digital transformation efforts at USAID. To do so, we are increasing the number of staff with digital and data experience in our USAID regional and country offices. We recently hired 25 digital development advisors and, via our partners at the President's Malaria Initiative, 14 health sector-focused data advisors. These new staff join embedded hires in ministries of health, new country and regionally based USAID digital health advisors, and health system strengthening and health informatics staff in our country offices around the world. Second, we are mindful of the local presence of the groups with whom we partner. Our digital health programs include many local partners and are designed to allow global level investments to transition to country stakeholders. For example, the PEPFAR-supported DataFi Consortium strengthens the ability of local partners to contribute to a strong country-led health information and data ecosystem. 55 local partner organizations in 22 countries have completed this online training on PEPFAR data quality and strategic information. This collaboration is building local capacity to harness the power of data to end the HIV epidemic. Lastly, USAID is deepening our commitment to co-investment as a critical component of harmonizing donor dollars with country digital transformation needs. For example, we're pleased to be a co-investor in the WHO and UNICEF-hosted Digital Health Center of Excellence, commonly known as DICE. DICE is an important new multilateral initiative that delivers coordinated technical assistance to countries on the use of digital solutions to address health information needs in COVID and beyond. Another example can be seen in our long-standing support for technical communities of practice, and that includes the Global Digital Health Network, hosts of this annual Global Digital Health Forum. We're proud to stand alongside a growing number of co-investors in supporting this vital work of global, regional, sub-regional digital health networks. To these leaders and members of these networks, we acknowledge and really want to appreciate your work. In closing, this strategic vision for improving health through digital transformation is fundamental to our global health efforts around the world, but it will only succeed through the continued partnership with government stakeholders, funders, implementing partners, and other members of the wider global health community, including all of you attending this week's Global Digital Health Forum. So I want to take the opportunity to enlist your continued collaboration as we work towards integrating digital transformation. Please join us to leverage global goods in your programming, to align your interventions to support and strengthen national digital health strategies and broader health system strengthening strategies, support and build digital systems to align with national health architecture, and last but certainly not least, to invest deeply in country digital health capacity. Working together, we can go further in our shared efforts to combat infectious diseases, strengthen health systems, prevent child and maternal deaths, and control the HIV epidemic. Thank you very much for the opportunity to speak with you today, and I hope that you find new knowledge, inspiration, and opportunity for collaboration during your time here at the Global Digital Health Forum.